One of the redeemed agenda goals of the present administration in Ondo State, led by Governor Akure, is quality and affordable healthcare services. As part of efforts to fulfill this promise, the state government initiated the Orange Health Insurance Scheme, ORANGHIS, among other health plans tailored towards providing qualitative healthcare to residents of the state. ORANGHIS, which was inaugurated September last year, is targeted at civil servants and political office holders, with the state government paying a premium of 60%, while enrollees pay 40%. This service, which covers medical services, surgical and pediatric services, obstetrics and gynecology, dental and eye services, alongside some rehabilitation services, are rendered without extra charges from enrollees, except in rare cases. The services began operation in December 2022. 95,791 public servants are currently accessing this facility, with over 35,000 of them being principal officers, while the rest are dependents. 56 hospitals across the state were engaged for the program. 9 are private hospitals, others government-owned, including 2 comprehensive health centers in each of the 18 local government areas to serve rural dwellers. These facilities include University of Medical Teaching Hospital, Akure Annex, Nigerian Police Medical Service, Police Hospital, Akure, Sky Hospital, and many others.
So far, I can't say we have. Though it's actually a learning phase. Yeah, people are adapting to the scheme. We are also adjusting to provide care for them adequately.
We have over 5,000 enrollees. So far, we have over 900 or more that has been coming ever since the scheme started. We don't charge for any of the services. Everything is free.
So far, so good. The turnout from enrollees, and many of them didn't believe it can work. You know, they just felt it's one of those means by which governments embezzle people's money, take monies from their salaries, and they don't see anything to show for it.
Enquiries on insinuations that the service is acting contrary to its objectives made OSRC speak to some beneficiaries of the scheme.
It's not up to 2 weeks now. My baby was on admission for 6 days. In fact, they really attend to me. Everything I need, they will give it to me. So for that 6 days, everything is okay. And they take care of my baby very well, to my own standard.
No, they not collect anything. They not wrote anything from to go and buy a drug outside. No, they just give me. They don't give me the. They go and collect code to go to pharmacy. Then they give me the drugs free.
Last month when I had malaria, so I do came here and they always take care of me. Even yesterday, I also brought my daughter here for treatment when she has malaria from school.
Mr. Victor Amoko is the chairman, Nigeria Labour Congress, Ondo State Chapter, and he hailed the ORANGHIS initiative, encouraged public servants to notify the union of any contract breach.
Since we have came, they should not look at it as if we are going back. Let all of us put our hands on deck to improve on it. So if you have shortcomings, let us know. Tell us the actual fact. Don't miss words, because some people they usually gain saying, I got there. Of course. I regretted going there. No. That's not the you. There is room for improvements.
Director General, Ondo State Health Contributory Scheme, Dr. Abiodun Oyeneyi, maintained that all health service point activities are being monitored by the agency to ensure enrollees are well attended to.
When we started, some people would say, no, you need to pay 10%. So we communicated with the hospitals that our own enrollees, we've trained them and we've taught them. They don't make any payment for covered services. If the services are covered, of course, not all services are covered. But our services are very robust, and you don't pay a dime for covers. You don't even pay for card. Everything is already paid for. So we just encourage people to be patient. We are ensuring now to make sure that we have drop-down banners in all the facilities to detail out what you are entitled to. Even if you can't remember, you can see it in front of you at the front desk there. We also encourage our TPAs to have stickers of customer care lines that if people get to the hospital and they have a challenge, they can call those numbers and they can attend to them.
He assured enrollees that the agency is working in collaboration with drug management agencies to ensure that medications are available in all the facilities. Omorinola, Hungbeji, OSRC News.